Hi, hello everyone. So today's topic of discussion is backache after pregnancy, and we have with us Sunita. She will be joining us shortly. She is a pre and postnatal yoga consultant. I think I already have the request. Hi Rishma. Hi Lavanya. Hi Archita. Lovely to have you guys with us today.
Hi.
Hey Heidi. Summers are fully on.
Yeah, very hot.
Yeah, I think we have Sunita with us. I'll just
Okay.
wait for him. Hi,
Hey,
Sunita.
Sunita.
Hello, Nilufer. Hello,
Good.
Vidya.
How are you?
I'm good. How are you?
Good, good. We are also doing good.
Nice to catch you all again in the night.
Yeah, same
Yeah.
here.
Yes.
Okay. Thank you so much, Sunita, for joining us once again, and thank you so much for being an integral part of New Mother. Having you
Thank you.
with us, strengthens us all the more. So it's always a pleasure having you with us. Always a pleasure talking to you. And let's start today's session.
Sure, Nilufer.
I had actually posted a story asking for people if they have any questions. So we had a lot of responses, on that story. So there are a lot of people who have questions. We will address them. Maybe once we start with our session, okay. As and when if I feel that we already have that question, I will plug in the questions which people have asked. Okay. So let's do it that way. And let's start with our first question. I'm straight away starting. If you have anything to say, Sunita, you can share.
No. We can start. As and when we go, we'll have a lot of things to discuss.
Okay,
Yeah.
lovely. So my first question is, what are the causes of backache after pregnancy?
Okay. After labor, so there are like multiple reasons are there. So basically, see here, one is the uh, core dysfunction, the core weakness, which has been caused during the pregnancy, right? That is going to carry forward during the postpartum period also. And when we don't do any kind of rehab, when we have completely lost the core connection with the mind-body connection is lost, that's one of the prominent reasons. Again, there are reasons like constipation and increase in the breast size, relaxin hormone. Hormones plays a huge role here again for the back pain. And wearing too tight clothes or heels, that also can cause back pain. So there are multiple reasons, and the postures, breathing pattern, breastfeeding. So there are many reasons. We can't just generalize, okay, this is one of the reason you have got back pain. Add-ons with so many reasons, multiple reasons added on together, it gets chronic.
Oh, yeah, that makes sense.
Yeah.
So, like you also mentioned labor, right? Labor pain, the birth process itself can lead to back pain. So, does it mean that if a person has, a very long and intense labor, then there are more chances of having backache?
Yes. See, if it's a prolonged labor and prolonged stressful labor, what happens is the muscles around your abdominal muscles, around the pelvis, gets overstretched and overstress. It gets, and it's overexertion, right? And because of that overexertion, it leads a lot of stress on the back pain. That is one of the reason. And other cases, even if it's a very less time, but if the woman has gone through a lot of trauma kind of feeling during the labor, like something fear or anxiety or some traumatic feeling if she has gone through, it is very much psychosomatically related to the back pain, and because of which also she might end up with back pain in postpartum. But mainly a long labor definitely leads to a back pain.
Okay, thank you.
Okay. How to maintain good posture, Sunita?
One is definitely wearing while we are breastfeeding, it happens like we tend to slouch the upper back. So what we can do is instead of keeping a pillow in the lower back, we can keep the pillow the upper back and make sure that we're at least maintaining a bit of posture, not at the always, but at least sometime. That is one way. Another way, doing the right exercises, because that will also help to correct our posture. See, sometimes we would have ended up with the wrong posture, but at least by doing the exercise, we get a little mindful and we can actually maintain the posture. So that is also one of the ways. Another one is taking care when we are bending and we're getting up, or doing certain activities at home, or picking up the baby, or doing some baby work, or whatever it is, trying to maintain the daily activities with the safe alignments. That also is better to maintain the posture, because we can't ask women to just sit or lie down in a straight spine, do all the activities, and that's impossible. Ideally, it doesn't work. Practically, it doesn't work. So we have to manage it mindfully with exercises and with our daily activities.
Right.
Yeah.
And how about the baby weight? Does the increased baby weight also cause back pain?
Yes, yes, yes. See, baby weight during the pregnancy only, if the baby weight is pretty more, that also leads to the back pain. Or even if the mother's weight goes beyond a certain recommended weight gain, even that also leads to the back pain. Because see, all of a sudden your muscles have to bear all that extra load, right? The pelvis has to handle all that extra load. If you have that amount of sufficient strength in your muscles, that's a different part. But definitely, right, when all of a sudden, when so much of load is added on, whatever exercise, whatever we do, it's definitely difficult. It's a little bit stress on the muscles. That is one thing. And also during the pregnancy, we start with the relaxin hormone. We start generating the relaxin hormone that makes the muscles so soft, and ligaments so soft, the joints so soft. It's very hard for the muscles to bear all the weight. So that is one of the reasons in pregnancy. In postpartum, obviously, right, the baby weight keeps on adding on every month. And definitely that is also leads to the backache. That's there.
Yeah, actually, I have, even I used to, while lifting the baby, right? I used to, stand like this,
Yes,
like
yes,
this.
yes, yes, yes.
Yeah, it means after pregnancy, that posture is like kind of, automatically set. All the time, the back is going like this.
Correct,
So
correct.
it, yeah, how to correct it? Can you give some tips?
See, there are two ways where we can go wrong. Either when we hold the baby like this, we push our pelvis forward, we take our chest back to allow the baby to lean on us. That is one way. This also leads to the back pain. And as the baby grows bigger, no, we tend to keep it on our waist. And we try to slay. Our spine literally enters into a different curvature. So that also
Yeah.
leads to a back pain, because a pelvis, right? It just one pelvis goes up, one side of our pelvis goes up, and the other side goes down. That neutrality is lost. So we lose that
Okay.
stability. So in such cases, obviously when the baby is cranky and all of that, we can't maintain a pelvis posture and get aligned and all of that. That is impossible. So what I say is we can't just handle all of that together along with the baby and ourselves. So in a day when we are doing our maybe like our housework or anything in between, when we have the time for ourselves, that time I want everybody to do with the pelvic tilts, doing the pelvic tilt. Now the pelvis is in the neutral position, doing the anterior tilt and the posterior tilt, doing couple of times, maybe like 5-10 times in a day. This helps to get that neutrality of the pelvis. Your body doesn't forget that neutrality, basically. So if your body
Okay.
just remembers that, even there is a slay back or in the slide movements or a slouch, you can definitely get back into a normal position with a little bit of exercises. It's not like your body is completely lost with the connection with your mind. So that way, at least the pelvic tilts has to be done in a day.
Yeah, I was, when you were telling, no, the sides when we hold the baby, I was remembering my mother and grandmother. See, they were so used to holding the baby,
Correct,
right? I mean,
correct,
they were used to even carry water pots and all.
correct,
Of course,
correct.
it would not sit. Now I could not make my baby sit on my waist. It
Yeah,
was like, no, you're not used to, and all that.
that's
So
that.
I
they
do
never
that. I
complained.
do that all the
You do.
time.
Actually,
Like
that's the
how
It
most
precious the
comfortable.
baby.
doesn't sit. Yeah, it's the most
Comfortable.
comfortable
Yeah.
way.
But you know what? When if you
Okay.
have to do that, see, if you have to, if that holding that position if the baby is very comfortable, then work on strengthening your glutes. Your glutes are the
Okay.
greatest stabilizer muscles of the body, biggest stabilizer muscle of the body. So if your glutes are really strong, even if you're slayed to one side, your glutes will be really strong enough. It doesn't put the pressure on your lower back or onto your knees or
Hmm.
ankles. It just allows, it takes all the pressure and it helps you to stay neutral.
Okay.
So that's one way you can do it.
Okay. Yeah, so you mentioned some exercises, right, Sunita? Now, say you mentioned something called as pelvic tilts, okay? I'm sure like most of us are not aware what pelvic tilts really are, okay? So,
Yes.
and if someone just starts Googling pelvic tilts and start doing those exercises by themselves. So can there be any side effects of such a thing? Okay, like how
Okay.
should that person really approach exercising in a safe way? Like what is the safe way?
See, Googling, maybe you might find out a couple of videos and you can just start off. But I'm not sure how much importance they've given and how much right they have told along with the breath work. Okay, because that is one of the major mistakes that I see. And I say, at least for the starting few days in the postpartum, better go to an instructor, learn the basics, and then do it on your own using any videos. But that first starting few days, I always say that take the instructor help, somebody who is known in this field, who can really help you and they know that you can't be wrong. That's very, very
Right.
important because nowadays I get many clients who get back pain because major complaint is back pain, but they wouldn't have got back pain because of their pregnancy or postpartum, but they would have got back pain because of the wrong exercises they have done after the labor. Because of that only they end up with severe chronic back pain. Many clients complain on this. So I say that to better ask somebody, just take at least 3-4 sessions and get some help, somebody, and get that knowledge. First is the knowledge. You need to get that knowledge, get that mind body connection, then do it on your own. Don't jump
Yeah,
into
that is
the.
the best thing that
Yes,
you have always been talking about, and we have been also stressing
yes,
about it. Like, if you really want to solve any kind of physical issues that you're facing after pregnancy, and you are approaching either yoga or physiotherapy to solve those issues, then it's best not to start off by yourself. Okay,
correct.
and it's not like you have to really pay for every session and continue these sessions for over a period of
Yes,
1 month or 2 months or anything. So Nita has always been very vocal about it that you can actually have that session done for maybe 3 to 4 days, okay, or 3 to 4 classes, and then you can learn the right way to do it, and then you do it by yourself. That is the safest way that we can
correct.
actually think about, because when you are with an expert, that expert along with just giving you the exercises will actually evaluate your situation and see and assess that where you stand physically, how fit you are, what are the right set of exercises for your body, and what can really help you. So that is
Correct.
something. Yeah, thanks for that, Sunita. Thanks for bringing
Yeah.
that up. That's really important, I feel.
Yes, yes, very important. Because there's no point in ending up somewhere, right? Thinking that
Yeah,
something good is happening to us. That's very bad.
yeah.
It's
Yeah.
that.
How can DR impact backache, the
Definitely.
diastasis issue?
Diastasis recti. See, diastasis recti, it's an ab separation, as I told in my last slide.
Yeah.
So here, DR, definitely it's caused because of the core dysfunction. It's because of there's a completely core and the pelvic floor dysfunction only DR has been caused. So that means there's a complete weakness in the abdominal muscles. When the front portion of your core muscles is like completely weak, all the pressure goes onto your back, and because all the organ starts pushing backwards and the complete displacement of the organ is there's no stability, and the few of the muscles would have got extra stretched or over tight during the labor, and all of that reasons along with the DR, the backaches will be pretty severe, and that has to be addressed accordingly. By fixing the DR
Right.
we can
So,
actually fix the back pain.
okay, okay.
But for
So
people who
when we
don't know
talk,
what DR is, maybe like Vidya, you can just say a line or two about DR. Like, maybe there are people who may not really know what it is.
I think Sunita can
Yeah,
tell
maybe
you.
Sunita, you
Okay.
can tell
Yeah.
about
Yeah. So DR it's nothing but diastasis recti, which is nothing but the ab separation in which during the pregnancy, the linen alveoli just gets separated little bit in between to in order to fit the uterus, uh, the baby, in order to fit the baby size. As the uterus goes bigger, the ab separation happens. That's very, very normal. But beyond a certain limit, and when the ab separation is there and it doesn't come back to its original shape post labor, that case is called as a DR, that we end up in a DR, diastasis recti. So in that cases, the ab separation will be deeper, like 2 finger or 3 finger gap around the navel, above the navel or below the navel, and which that has to be addressed and fixed. Only then the organs come back to its position, like as it
it. Yeah,
was before
thanks
pregnancy.
for that, Sunita.
Yeah.
Yeah.
And how to self-check diastasis recti, we have already covered it in
Yes.
previous
Yeah.
session. Yeah,
Yes.
So yeah,
you
you can
can
actually watch
check
that
the link.
session.
Yeah. And when we are talking about backache, where is the ache? I mean, which part of the back is we are talking about?
See,
I mean, complete spine, or I mean, how they should know that this is due to diastasis recti or core muscle pain. I mean, which part of the back will really ache a lot?
I
see,
think they should
as
not know that, Vidya, that it is due to what. Then it becomes a self-diagnosis, right? And that is the most
Ah,
dangerous
okay.
part.
that is
I think
also
the
there.
best thing to do is if you're having any issue with your back, if you're having backache and all, we will definitely give you few tips and tricks, but it's always, beneficial for your own safety and health that you consult, the right expert.
Yeah,
at least consult
good
and then,
point. Yeah.
get a assessment done for yourself that what exactly is the issue. Yeah,
That's true.
Yeah,
and then
That's true.
you can take a call. Obviously, it's your call. You can decide what you want to go ahead with physiotherapy, postnatal yoga, or you just want to go ahead with some allopathy medicines. Whatever course you are going to decide, that's up to you. But then for the initial assessment, it's always best to reach out to an expert.
Yes, yes,
yeah,
definitely. Don't judge yourself and don't land
Yeah,
it somewhere else.
yeah.
yes. So yeah, there's one more question called reason for tailbone pain.
Yeah.
Tailbone. Okay, this is the complete coccy pain, what we say, the lower one, the coccy pain. See, there are many reasons for the tailbone pain, and most of the cases, this would have been started during pregnancy only. 90% cases, this would have started during pregnancy, and that will be carried over during
I
postpartum
just
also.
want to stop you
Ah,
there, Sunita. I'm so sorry for that. I experienced this pain, okay, and
okay, okay,
I experienced this pain even before I got pregnant.
okay,
Um, okay, I experienced this pain before I got pregnant. During my entire pregnancy, it just vanished away. Okay,
okay,
but
okay,
before I got pregnant, I remember very clearly. It was maybe at around the time of my periods or something, and I had that pain consecutively, just like before I conceived. Okay, I don't know what that
okay,
was,
okay.
and it did not really continue into my pregnancy, so I did not really investigate it. But yeah, I did experience that pain initially. So can we also address if somebody is having pain, before being pregnant, pain
Okay.
in the coffin?
Then you had pain postpartum also. You didn't have pain at
No,
all.
no, no.
Okay, okay. Sometimes, this coccy pain would be mainly because of the posture. That is the if it's not pregnancy and all of that, I'm saying. Forget about pregnancy, postpartum and all. If you're getting the coccy pain, it will be mainly because of the seating posture. If your glutes are weaker, or if the posture is wrong, and such cases only we get the pain. Or if you're using a lot of heels or tight clothes around the waist, that also can lead to the coccy pain. So that is one there. But apart from that, if you're getting back pain without pregnant, that's a different case. Like we need to check where is the stiffness and what is the issue and all of that. Or if the core muscles are weaker, also the coccy pain can be there. But mainly it's because of the posture. But in the pregnancy, if you're saying, if in the pregnancy, most of the women start getting this coccy pain because they start getting the tilt the anterior pelvis. Means, see, in pregnancy, the tilt of the pelvis happen naturally because of the weight of the uterus, and that is an anterior tilt. But in certain cases, for certain women, without their knowledge, they would have tilted deeper beyond a certain limit. And that is when there'll be a deep curvature in the lower back, which leads to a lot of pain in the coccyx. That is one of the reasons. Or else if it's a multiple pregnancies, like subsequent pregnancies, like 2, 3, 4, if they're having like that, there'll be a lot of weakness around the pelvis joint if they've not done proper rehab of the core muscles. If they have a lot of pelvis pain, then the pelvic girdle itself will be paining. The entire girdle will have pain. And when the entire
Okay.
girdle is paining, the first stress among the entire region goes towards the coccyx. So that also might be the reason. And postpartum, the main reasons are the constipation. Constipation leads to the coccyx pain. Okay, constipation,
Okay.
DR, and pelvic floor dysfunction, weak pelvic floor, stress incontinence, and umbilical hernia. All these reasons can lead to the coccyx pain. But definitely it is reversible. I have to say this because it is definitely reversible. We can, within very few sessions, we can start reducing the pain gradually. And progressively, you can feel that the pain is completely gone. You can definitely know that is there. Another one main mistakes what we do, the reasons in postpartum is for the coccy pain, we just pick anything from the floor with the knee straight without even bending the knees. That leads to the coccy pain more deeper. That's a tailbone pain.
And that makes that kind of like, that positive thing that you say, that it can be reversed, it can
Yes.
be healed, that gives a
Yes.
lot of strength, to the
Yes.
people who are watching this. Yeah. So we spoke a lot about, like, the reasons that, why you can have a back pain. We spoke, like, so many reasons. There are so many reasons for which we can have.
Yes.
Today, when I had actually posted the story, right? So I had so many people posting same question. It was like maybe the words were here and there, but the question was same. There were other questions as well, but I'm going to talk about the question that was like, that most of the women had. And it was that they have back pain. Okay, they have back pain, and they're like, in the early months of the postpartum period, maybe like 3 months, 4 months. Okay, so the range varied. Like some were just 2 months. Till, like, I think we encountered questions even up to 6, 7 months in their postpartum, and people have this back pain. Okay, and yeah, another common thing in that question, which I like kind of categorized, was that all of them had C-section. Okay, their question was not that whether C-section leads to back pain, but their question was more like, what should I do now? Okay, I
Okay.
have back pain. I had a C-section so and so months ago, and now I'm having back pain. So what is something that I can do to get rid of it? But even before we go to that question, that what we can do to get rid of it, my question to you is: does C-section have anything related to back pain? Like, is there any relation between these two things?
See, why C-section? Mainly people who have gone through C-section complain with back pain because of the scar adhesion, we say. See, it's not because of C-section, because of the scar which they have gone through, right? That scar, they wouldn't have massaged. They wouldn't have massaged the scar with the oil postpartum. And because of the adhesion which is being created around the scar, the push and pull of the tissues and the new cells, new tissues which is growing around that scar area, right? This starts pulling the soft tissues in the muscles around the back. And because of that, they lead to the back pain. And not
Wow, this
because
is something new actually.
yes, because of the
Yeah.
scar. So if they can immediately, once the scar is little dried up, maybe after a few weeks, once they feel it's dried up, they should start massaging the scar. If they can massage the scar with any oil, maybe coconut oil or almond oil or any other cooling oil, don't put any heat oil, basically cooling oil. If they can massage the scar every day regularly for 1 or 2 minutes, they can reduce the back pain. That is the reason
Wow,
for
that was something
that's
like, completely
Yeah.
unexpected. Like
yes.
wow, that's something completely new.
Yes,
Thanks for
because
sharing
see,
it.
yeah,
Yeah.
welcome. So the root cause is somewhere, but we'll be thinking about something else. It's always that. So we need to look at what is the root cause and we have to fix the root cause. There's no point in just treating the symptoms. So that is the reason the scar has to be healed. Only if it is smoother and there's no stiffer around the scar area, means it should not be like thick layer of that scar. See, now 2-3 layers has been stitched,
Yeah.
right? You find like thickness, right? That thickness should not be there.
Yeah.
It should be like very smooth, just like any other skin. Like it should be like very smooth. When you touch it, it should be like very smooth. If it's very smooth like that, you'll not have any adhesion. What we say, like that push and pull of that muscles and the tissues around that scar, and that is enough to heal your back pain. It will not pull the muscles and the organs, and it will be relaxed. So you have to put oil. The massage is required.
Wow, that's awesome. And would you like to say something to all the people who have asked this question? Like, from my end, if I have to say something, I would say that, I would definitely recommend them to either have a session with you, one consultation with you, or have a consultation with anyone else, whomever they prefer. But then through that, you are suffering with backache, and that is something that can be fixed. You don't really have to suffer with that. You already have a lot of things on your plate. So this one thing you can take of book a consultation with an expert. Sunita is available. You can contact her. If you cannot reach her, you contact us and we will redirect you to her. But then, yeah, first book a consultation. There are so many reasons for which you can actually have a backache. Okay. And instead of sitting and analyzing it for yourself and identifying issues, and then practicing something, starting something by yourself, consult one have one consultation, and then that can lead you in the right direction. Then you practice by yourself. Definitely, like, we are not recommending you to join any classes or anything, but have a consultation. That is really important. Yeah.
Yeah.
We have another question, Vidya. Are you able to see that question from Nikki?
Yeah, yeah.
Yeah.
Yes, yes. So, what are the best birthing positions while having lower backache due to some bone degeneration?
Okay, bone degeneration. So they mean like osteoporosis or something like that?
Not
I
sure. Um, they have just mentioned what are the best birthing positions while having lower backache due to
Or,
some bone degeneration. Yeah.
uh, okay.
Uh,
The best position would be either left side, lying down to the left side, or on your knees and the palm on the floor, or just lying down on the ball in the front, just lying on the forward in the ball with the knees down and the side lying position. This is the best position if you have back pain. Because if you're resting your back on the floor, the back pain actually shoots up during the labor. And it's be
mhm.
very hard to deliver naturally. And also it will slow down the process. So if you have back pain, I feel these two are the best position, and it works. Definitely it works.
Some very good points in this session. Yeah. So, how to overcome chronic back pain? We have already covered this, but yeah, one second, I'm just checking.
Yeah, there's one more question that we have. How to
Mhm.
regain strength after. Vidya, are you done with your questions? Can I go ahead with
No,
the.
yeah, no, you can. There are some more actually here.
Yeah, please, then you can continue. I'll.
Yeah. Does Kegel exercise prevent back pain? I'll read two questions, okay? These two
Ah,
are interrelated, I think.
okay.
Does Kegel exercise prevent back pain? Pelvic girdle pain leads to back pain? Is the question mark. Does pelvic girdle pain
Pain?
lead to back
Yes,
pain?
yes. As I told before, no, the pelvic girdle pain, entire pelvic girdle itself, it keeps paining, and because of the subsequent pregnancies, or if their strength is very weak, if their core transverse muscles are very weaker, because of the pelvic girdle pain, definitely it leads to the back pain. No doubt in that. You will have a pain in the back. And one more question was with you. I forgot.
Kegel.
Kegel.
Can
Uh,
Kegel cure? Yeah.
Uh, no. Kegel, see, it is not a cure for the back pain. Definitely, Kegel is not a cure. I don't know. It's like a misconception. I don't know how it has come up. See, pelvic floor is just a part of your core muscles. It's not your core muscles. It's just one down layer of your core muscles, and it's not an entire core system. So you're just working on the Kegel, like you're just squeezing, contracting, and relaxing, contracting and relaxing. You're just doing that. And most of the cases, like 90% of the women, as I have seen, they don't even sync it up with the breath. They don't do Kegels along with the breath. If they're doing with the breath, most of the time they'll be doing the reverse way of doing a reverse breathing along with the Kegels.
Mhm.
And that, in fact, leads to hypertonic pelvic floor. That means it tightens up the pelvic floor even more. And this tight pelvic floor is like tighter and shortens the pelvic area, which actually gives a lot of back pain. Indirectly, it's to a lot of
Okay.
back pain. And it can, and if you're hypertonic, it can also lead to stress incontinence also. So Kegels is not the answer. Along with Kegels, if you know how to relax the pelvic floor, and if you know also how to work on the other portions of your core, like transverse abdominal, spinal stabilizers, obliques, if you're doing all of that and also you're breathing right, then it works together, but not just Kegels. That is a
Okay.
wrong misconception. But I say to most of the women, don't just do Kegels blindly. You will lead up to most of the unknown issues, which you'll never know that because of Kegels is the root cause. Most
Mm-hmm.
of the time, I have seen these issues. What they do is, like when they inhale, they try to contract and lift the pelvic floor up, which is completely
Okay.
wrong. When you're exhaling is when you have to lift the pelvic muscles up. That is when you have to contract. So you're just trying to reverse the entire internal process. When you're trying to reverse the entire internal process, it leads to dysfunction. What else can it lead to? It definitely leads to dysfunction.
Mm.
You're okay, this is some functionality. You're saying that, okay, we'll reverse everything and make it work in a different way. So together, it leads to a damage of your system. That's it.
Yeah. Actually, I've seen, okay, some reels from many people, like they are saying while working also I'm doing Kegel, just pulling of, pelvic floor muscles. It's,
Don't do too much.
yeah,
Don't do too much.
sending so much wrong message.
No,
Yeah.
no, no, don't do too much. In fact, for my clients, I never teach Kegels unless and until it's really, really necessary. I try to work on the complete core as a system. I never isolate pelvic floor and say that, okay, just do on this, all your issues will be fixed. Core should not be isolated. Core is like a cube. All the upper layer, down layer, side, front and back, everything has to be worked synergically together. It has to work like in one system. Only then you'll get the result. If you say only the down portion I'll work, I like only my diaphragm, I'll work on that, I like only obliques, I'll work on that, it will not work. It will not give you any benefit. It will not give us any benefit. It should not isolate. It has to work in a system. It should be in group together. See, to support your baby,
It makes
entire
sense
organs have
also,
come
right?
together,
It makes
no?
sense.
Yes,
Yeah.
it makes sense. And one more thing, what you have to see, Kegels, if you're doing wrong in a longer run, definitely that women will lead towards stress incontinence. This I've seen in most of the cases. Definitely, without their knowledge, they would have been entered into stress incontinence. Another one is a lot of anxiousness because you're reversing the process. That means you're driving different signals to your mind. When you're inhaling, what has to happen? That is not happening with your pelvic floor. When you're exhaling, what you have to do? That is not happening with your pelvic floor. So it's a wrong signals to your pituitary gland, what you're giving. You're asking to reverse the process fully, completely. And that leads to more of anxiety in women. So mentally and physically is the damage. I will not.
Thank you so much for that. You know, just one thing to point out. Oh, Vidya, you have something really coming up. Yeah, please.
I saw, okay, somebody, there is some ball kind of which they use for Kegel. Is it really? Yeah, I mean,
Right,
is
they use
it?
that. Not required. Not required. I've
Yeah.
seen also a few of the meters, devices which they use for the Kegels. It's not required. I feel that if so much you have you have lost the complete connection with your pelvic floor, I would definitely ask you to meet the pelvic floor physiotherapist. You
Yes,
have a
definitely. If you
physiotherapist
have
for
that much issue,
pelvic
you
floor.
have to.
Yes,
Yeah.
you have to go to them. Pelvic floor physiotherapist, they'll be specialized in that. They will help you to get the connection of your pelvic floor as you go with the breath. Okay, and that is the right way, and you have to do under their supervision. And don't just buy the meters which you get it on Amazon. Don't buy the balls which you get it on Amazon, and don't experiment on yourself. Definitely no.
See,
Definitely no.
actually, I really feel like even I was one among those people, like, people really don't know a lot about pelvic floor, okay, how
Yes.
important
Yes.
pelvic floor is.
Yes.
If there is a dysfunction of your pelvic floor, then, like, I don't know what to say. It's a disaster to your body.
Yes. Yes. Yes.
Truly speaking, okay. I think let's have a session only on pelvic floor,
Yes. Yes.
Sunita.
Yes.
I
Yes.
feel like
We should.
it's really
Yes.
needed
Lot to
because
cover in
we
that.
spoke. Yeah, we
Yeah.
spoke about Kegels, and Kegel is like now it's like kind of a fad, okay,
Yes.
and it's kind of
Yeah.
trending.
Yes.
I
Trending. Yes.
also like we also get some questions like, is this a trend yet? Okay, if we say something like, people are asking, is this a trend yet? Doesn't have to be a trend.
No. No.
Like,
No.
this is your body, okay. You cannot just keep following trends. Like,
Correct. Correct.
you have to. I don't know. I don't have words for that, but yeah, let's plan for a pelvic
Yes, we can
floor
do that.
session, because I think that is a topic which cannot be justified by covering in one session also.
Yes.
But then
Yes.
let's try to have a session on that.
Sure. Sure. Sure.
Yes.
Thanks
Yes.
so much, Nita, for that insight on Kegels.
Yeah.
Yeah.
Actually, only on Kegels, I think we can make a session.
Yeah.
Yeah.
We can plan.
Lot of
Yes.
misconceptions, and it is driven completely wrong. As I have seen few of my clients, they have been asked by the doctors to do Kegels. Doctors in the sense,
Okay.
like gynecologists, when they are under stress incontinence or just like that, they're just like, you can do Kegels exercise. But how it has to be done,
Yes.
who it can be, who all can do, no, and how, where and when, nothing of that has been told. Just do it,
Yes.
and they'll just browse and they just start doing it. And
Yeah.
and other mistakes is like when their bladder is full, they have done Kegels, and that leads to so much of issues. So many mistakes
Yeah.
and around the Kegels, a lot of things to discuss in that.
Yeah.
Yes. We will. And coming back to our backache, yeah. Can epidural cause backache?
No, Vidya. See, there is no research or no proof to say that epidural will cause back pain, but this is again a misconception. Like most of them say that because I got epidural and this has led me to back pain. I don't believe that. See, if your core is strong enough, if you know how to have that connection of your mind and your body with your core muscles, and if you are doing a core rehab postpartum, you will not have any back pain. You'll have slight discomfort in your back, but that will go as you do it, as you strengthen your core muscle. That's not an issue. See, I have
Even
seen clients.
Yeah, why I can talk on that because I myself had an epidural. Okay, I
Yes.
delivered
Yeah.
my baby
Hmm.
through an epidural. So no, that it does not have any relation,
Correct.
with back. As Sunita mentioned, it's all about your core muscles, about your glutes,
Yes.
how strong they are,
Yes.
how much you have actually worked them out before you got pregnant, how you,
Yes.
went through your pregnancy, and what are the things that you're doing during your postpartum period. So that's all what counts, along with,
Yes. Yes.
all the other lifestyle changes that you will have to do.
Exactly.
Yeah.
Exactly. That is there. So no, that is not directly related at all. But I feel most
Yeah.
of the women take it as a chance to blame on epidural instead of working on them. I feel
I
that
mean,
work
we
on
try,
myself.
yeah, something to be blamed, you know. It's easier. It's
It's
easier like
easy.
that.
That is there.
I think, yeah, I think after this question,
Mm.
Nilüfer can start asking.
Mhm.
So, sciatica pain, how to handle? I think this is another vast topic,
Yes,
but
sciatica
we
is a
can
must.
just tell, yeah, we can just tell them some simple, yeah, I mean, very short
So
answer.
sciatica in pregnancy, you're asking, or postpartum?
Maybe
They're not mentioned, but I think post-pregnancy. Yes.
Post-pregnancy. See, post-pregnancy, most of the cases it'll be started during pregnancy only, sciatica pain, because of the baby position, and that way if the baby remains in the breech or in the transverse position after 36th week, the sciatica pain shoots up for most of the women. Another one is
Okay.
if they're using recliners for breastfeeding, if they're using recliners during the pregnancy, and also that wheel
Mhm.
kind of chair comes on, just like this kind of push kind. I don't know what you call
yeah,
that chair.
Yeah, yeah.
Those kind of chairs, all that leads to sciatica pain. Because why is the reason is you're tucking the tailbone fully under your glutes and you're leaning backwards for a longer time, and that presses the
Right.
sciatica nerve there. And you're not sitting on your
Mm-hmm.
sit bones. Basically, you're not sitting on your sit bones. You're sitting on in between your glutes and in your back muscles, where exactly the sciatica nerve runs through. And that is why, that is also one of the reasons why you can end up in the sciatica pain. And postpartum also the same reasons. The one is the posture, mainly is the posture, and the stiff muscles. If the muscles have got very stiff around the pelvis, like hip flexors, glutes, if it has got very stiff, even then sciatica pain will shoot up. One is for
okay.
sciatica pain, best thing is you have to stretch and strengthen simultaneously. You have to work hand in hand to get rid of the sciatica pain. But again, I will say it is 100% reversible, sciatica pain,
Okay.
without medication, without any surgery or medication, but just by proper exercises, breath work, connection of your mind, body with the core, you can reverse it. And progressively, you can lessen the pain definitely within few sessions. That's there.
Oh, okay.
Wow.
Yeah, thanks for
Yeah, good point
sharing.
with the recliner chair. Actually, when I had taken one for work from home and I had severe backache.
Yes,
I
yes,
was
yes.
like, this chair is not good for me. Everybody was like, hey, this is recliner versus no. I said, no,
Correct.
no, I am getting backache.
Yes, yes.
Now I understood why I got that. Yeah.
I
Yeah,
say for all my
Neelofer.
clients, no recliners, no that push and whatever the chair, that wheel kind of chair will
Yeah.
be there, right? With just like laying down like
Yes.
a cradle, all of that. None
Most
of that.
offices have that.
Yes,
Yeah,
yes,
most
yes.
offices have that.
Yeah.
Nilüfer,
Yeah,
over
I'll
to
go
you.
ahead with my question. My questions means all the questions that we have,
Mm-hmm.
Yeah.
been receiving from different people. Okay,